Welcome. Today, we're going to talk about what every physician needs to know about the difference between THC, CBD, Delta-8, and hemp. Now, once upon a time, physicians would ask patients only about marijuana use. That was the only term that people used. But these days, there are so many other products and terms. Most doctors may know about THC joints or gummies. Maybe you've heard of CBD. Perhaps you've heard about hemp in the news. You might have heard the term intoxicating hemp, or maybe someone's asked about using hemp seed, and you wonder, is this legal? Or maybe you've heard the term synthetic marijuana. And a patient may have asked about CBG and pain, or CBC and cancer, or THCV and weight loss. And or a patient may say they use Delta-8 and you wonder what that is. Hi, I'm Dr. Janice Mackla. I've been a physician for over 20 years. I'm board certified in geriatric medicine, hospice and palliative care, and internal medicine. I'm a hospice medical director, and I'm your guide today for learning about the ECS and cannabis. So now, do you know what these different terms mean? Cannabis, marijuana, THC, CBD, and hemp, Delta-8, THCA, cannabinoids, and terpenes? If you don't, you're not alone, which is why we're here today. Now, you may say, "What? I live in a state that doesn't have legal cannabis. This doesn't matter to me." No, it's still important to know. Hemp based products are sold more frequently in states that don't have dispensaries, and we'll talk about why that is the case. THCA, Delta 8, CBD, and hemp derived THC can all be purchased online from smoke shops, even bakeries. Liquor stores are selling hemp derived THC drinks. And of course, patients can also illegally get THC products from across state lines or from other informal means. So, now, why don't we use the term marijuana anymore? Well, first of all, the word marijuana was not actually a very good term. It was originally a slang term from Mexico for the cannabis plant, and that got adapted in America as part of a xenophobic propaganda campaign that associated the word marijuana with immigrants from Mexico. The name was also part of the whole criminalization campaign that specifically targeted Black and Brown communities. So it has a rather notable stigma to it. Beyond its history, the term itself was not precise. It can mean a lot of different things. It's been sort of a catch all term. And because of this, even in medical literature, we avoid the term marijuana. We now use the term cannabis. And what is cannabis? Well, first of all, it's the botanical name of the plant. Cannabis sativa, cannabis indica, cannabis ruderalis are all the names of the plant. And we now use that term instead of marijuana for products of the plant. And then, just as a side note, most active chemicals from the plant actually are derived from the female flower of the cannabis plant. So things that are extracted from cannabis are often called cannabis. So we have different names for many of them. And of course, it can refer to THC or CBD products as cannabis. Now, some of the terms for chemicals derive from the cannabis plant. So the first thing is THC. Now, THC is short for tetrahydrocannabinol, and it is the psychoactive component from cannabis. It's what gives people the high. It also has medical properties. It works in our body by activating the CB1 and CB2 receptors. And I think I have a lecture you can see if you don't know what those are. When extracted from the plant, the THC has an isomer forms. So there's actually Delta-8, Delta-9, Delta-10 THC. And the most common isomer is Delta-9. Now, if it's isolated or synthetic, you will actually see some products advertise it as Delta-9 THC. But that's just regular THC. Now, what are cannabinoids? Maybe you've heard this term. Now, this is a general term for all non THC chemicals from the cannabis plant. It's chemically related to THC, but they have different effects. They're non-intoxicating. Most act on other receptors besides the CB1 and CB2, and the plant makes more than 140 cannabinoids. CBD, CBG, THCV, CBC, THCA are just a few of them. Some of the medical effects of these cannabinoids. For most part, the research is very early but ongoing. There's a lot of preclinical research and very early studies in some human studies and some animal studies. Now, in vitro studies do show that it activates our endocannabinoid system. So, again, they're considered cannabinoids. And they do have some potential role in health. There's a lot of active studies about a bunch of the different endocannabinoids working with cancer, pain, neuroprotection, weight loss. And because of this early research and sort of the hype around it, there are a lot of patients who are using these for wellness. It's important to know what a lot of the most popular cannabinoids are and like what their effects and their drug interactions and their side effects. Um, but CBD is the most researched cannabinoid, and it's the only one that's FDA approved. Now, what is CBD? Well, that's short for cannabidiol. It's the most commonly produced endocannabinoid. It's not a placebo. Years ago, I was said, "Oh, it's a placebo," particularly as a lot of very poor quality CBD flooded the market and didn't do much. A lot of people thought that this was just a placebo, kind of a wellness fad, but it is actually very biologically active. It acts on several different receptors, but not the CB1 or the CB2 receptors. So it's not intoxicating. It is now actually FDA approved, particularly for certain types of childhood seizures. And most people are not using the FDA approved CBD. They are using a CBD that they find elsewhere. Now, there are studies, research that's ongoing to say it can help with anxiety, psychosis, autism, and pain. None of those are FDA approved. And the studies are still very much ongoing to determine this. Patients, though, are already self medicating for this reason. And it's important to know that it can interact with many medications because it affects the liver and it can raise liver function tests. Much is unregulated. So many of the things are unregulated about this. So it's prone to contamination, it's prone to quality problems. A person needs to get it from a good source. Otherwise, it might not be what they think it is. Now, terpenes, there's another term you might have heard. Now, terpenes are chemicals produced by the cannabis plant. They are aromatic and volatile. They create the scent of the plant in the flower. Some can give a pine or a peppery or a citrus smell. And actually, when you see pine trees or pepper or citrus, that distinct smell is actually created by their terpenes, which is also in cannabis in many cases. They also have physiologic effects. Research is ongoing, but there's a lot of studies about anxiety and sleep with certain terpenes. You might actually need to have a higher dose than the plant has. Also, research is being done on these exact same terpenes that show up in other herbal plants and herbal remedies. Now, the amount of different terpenes is going to vary by plant strain. And this is part why there's so many different strains. And it gives the strains a different smell. And it's also part of the reason that people who do smoke it for a high will say that the different strains will hit differently. And it's part of the reason why you might get some variability in response to someone who had responded well to cannabis for something and then goes to a dispensary, gets a completely different strain or a completely different product and doesn't respond as well to it because the terpenes and also the cannabinoids might be a little bit different in the product that they now have. Now, so let's talk about hemp. You may have heard this term. It's been in the news most recently. Hemp is a specific strain of the cannabis sativa plant. It often goes under the name of wild cannabis, ditchweed. It's legally defined as having less than 0.3% THC in it. It's federally legal under the Farm Bill, and it's not considered intoxicating. It does produce CBD and the other cannabinoids and terpenes. And if you were to get a full spectrum CBD product, that's a CBD with the terpenes and cannabinoids, that likely comes from a hemp plant. Now, it has many industrial usages, particularly for its fiber. And then also you can get hemp seed, which is non-intoxicating. It doesn't even have CBD, but it's full of protein and omega-3. And a lot of people use it as a dietary supplement or an added form of protein to their food. Now, then there's another thing called THCA, and that's tetrahydrocannabinolic acid. And the cannabis plant does not actually make THC directly. If you were to get a raw cannabis plant and just eat it, you would not get that much THC in it because the plant makes the THCA as a precursor of THC. Heat, time, UV light will actually decarboxylate it to THC. So at harvest, a cannabis flower mostly has THCA. Now, there is some evidence of THCA having medical benefits by himself. There's some promising animal studies, particularly looking at metabolic and neural health. But the research is hard to do because it's difficult to isolate from the THC because it decarboxylates so readily. So there's very rarely a sample that doesn't have at least a little bit of THC in it. Now, the 2018 Farm Bill did not include verbiage about THCA in its calculation of THC. So it was federally legal until recently. After late 2026, when the revisions to the Farm Bill go in, it will not be considered hemp. Now, you may have heard the term intoxicating hemp, and this is what they've been talking about a lot. Until recently, the cannabis sativa plant with significant THCA, as we just mentioned, but less than 0.3 THC was considered hemp and federally legal. Now, as we mentioned, that's going to change in late 2026. But companies would convert legal THCA rich hemp that had less than 0.3% THC, and then they would make hemp derived THC products. And, as long as it's dissolved and it's less than 0.3%, it would be considered legal. And so they would convert the THCA by heating it to THC and call it hemp-derived THC, and it would technically be legal under the Farm Bill. There was a very specific wording of the Farm Bill that made that legal. Now, and so when you see THC beverages or you see THC at bakeries or even online, that's how it was happening. People could also smoke legal hemp-derived THCA and get high because, of course, when you burned it, it converted to THC. And then less feasible but possible, people could take a lot of hemp plants and at 0.3% at a time and get a lot of THC and actually make a THC product from that. Delta-8 is also considered an intoxicating hemp. And so it's not actually the THC sold in dispensaries. That comes from a plant that actually does have a larger amount of THC in it and is considered cannabis. And so these were not being sold in dispensaries, and they weren't subject to the same rules as dispensaries are. So the quality, labeling, and purity might vary depending on the product. Now, we've heard the term semi-synthetic and synthetic cannabis. Synthetic cannabis, it gets thrown around a lot. Oh, it's synthetic. Well, all it means is they didn't use the plant. It was actually developed in a lab. They took the initial chemicals, just like the plant does, and put it all together to make THC. In fact, dronabinol, the FDA approved cannabis, um, is actually made synthetically to avoid the legal issues of having to grow cannabis. Semi synthetic is derived from a cannabinoid, usually CBD. Hemp plants make CBD. CBD is then chemically turned to another compound. And most commonly, this is how Delta-8 is made. And another thing that can be semi-synthetic is THCO. Both semi-synthetic and synthetic compounds have byproducts, enantiomers, isomers, and have solvents and chemicals that need to be washed away. And if you don't have a good product, these might not be washed away or removed prior to someone using them. Now, what's Delta-8? Delta-8 is Delta-8 THC. As I mentioned before, THC has isomers. The most common is Delta-9, and what that means is it has a double bond at the 9th carbon. Delta-8 has a double bond at the 8th carbon. Delta-10 has a double bond at the 10th carbon. So it is identical in all ways except for where this double bond is. The plant, in fact, naturally makes a small amount of Delta-8, Delta-9, but chemists have figured out how to make Delta-8 from CBD. It binds weaker than THC to CB1 and CB2. That position of that bond changes its 3D structure so it doesn't bind as strongly. And it's considered about half as potent as THC, but it's still psychoactive. It's often sold in smoke shops as legal intoxicating hemp. It's prone to contamination, as I mentioned, but changes to the Farm Bill will make it illegal in 2026, most likely. Now, what is THCO and THCP? You may have heard about these. THCO is a semi-synthetic. THCP is naturally occurring in small amounts, but both are significantly stronger than THC. Both are being marketed as hemp-derived, and you may see more of these after the Farm Bill in late 2026 because these were not included in the changes to the Farm Bill, by name at least. And they also might have some psychedelic properties. And again, there's more risk and contamination and side effects, especially the THCO. It's actually very dangerous to make. There's a lot of solvents that are extremely flammable. This is not a medical cannabis product. I would discourage patients from using either of these, and not only in a medical stand, but even the people who are looking into recreational. These are not particularly safe products to be using. Now, cannabis has become more complex over the last many years, but doctors still haven't been taught about it. Without our guidance, patients are self-treating and are at risk of harm. And we saw this over and over as I was talking about these different products, where the research isn't there, but people are already using it. People are asking advice from bud tenders and friends, or they fall prey to online snake oil salesmen, or they base their decisions on preclinical or animal data. They increase the risk of severe drug interactions, and they aren't aware of the risks. Many could develop side effects, or they could develop cannabis use disorder. Or worse, they may even choose cannabinoids over medications that they actually need because the hype sounds so much better than having to take this pill day in and day out. So we need to help them. Do you, though, feel confident in your ability to help your patients who use cannabis? If not, I have a program to help physicians gain the knowledge they need to treat patients who use cannabis. Message me, learn, if you want to talk further about that. Of course, like and follow if you want to catch the new videos as they come up, and I'll see you in the next training.